this question speaks to another part of the power of a DefineMBC test, and that is that it is difficult in patients as they progress along their journey for metastatic breast cancer to have multiple tissue biopsies to see if there is change in expression of such biomarkers as estrogen receptor and HER2 in terms of the protein. And we know now that there is a lot of heterogeneity in expression, which can be impacted by a particular therapy that is given. So we see HER2 change, and now, of course, we're in a era where HER2 low is important. So we can see HER2 zero going to HER2 low, or vice versa, or even going to HER2 high, or so-called HER2 positive. And so that's one thing to keep in mind. And the other is that estrogen receptor is also a dynamic biomarker and can be positive and turn negative, or vice versa. That this may impact our treatment decisions. We can't do tissue biopsies routinely on most patients. And certainly after you get to the second line setting, assuming that in the first line setting, one is successful to get a interpretable tissue biopsy. It really makes sense that if you have a non-invasive type of test like DefineMBC and gives you similar information as a tissue biopsy, that would be preferred. And that's what the respondents felt as well.